Welcome to Evergreen Family Medicine. Today we are with Allie Blaine. She's a PA at Evergreen Family Medicine. Welcome.
Thank you.
Let's talk about seasonal allergies. What are seasonal allergies?
Yeah, so Douglas County has lots of pollen this time of year, lots of grass, things are blooming. So people come in and they have congestion, runny nose, itchy eyes. Sometimes people get rashes on their skin, and all of that is kind of encompassed in seasonal allergies.
And you may not even realize that it's connected to seasonal allergies, I would think.
Yeah, definitely. People come in and they think they're sick, and it's actually allergies.
So what are some of the ways that seasonal allergies can be treated?
Yeah, so usually I educate people to first start with some over-the-counter medications, particularly Flonase or fluticasone. Glucocorticosteroid can be helpful just to clear up some of that congestion. So that's number one, is try Flonase even if you don't like something in your nose. The second step is an antihistamine like Claritins or Tecalegra, typically something that's not sedating but can help with some of the itchiness and scratchy throat.
And then is there another level of treatment that isn't over the counter?
There is, yeah. So people kind of get frustrated because it does take 3 to 5 days for Flonase to start working. So they're kind of like, oh, I'm still congested, I need something else, I'm maybe already taking an antihistamine. You can also get a prescription for an intranasal antihistamine, which is really helpful. Because when we treat the source of the seasonal allergies, rather than giving you a pill or something systemic, we can actually be more effective. So azathioprine is an antihistamine that you can use inside the nose while the Flonase or fluticasone is starting to work. So that can be great. And then you're not getting dry mouth or constipation from systemic antihistamine.
Now, earlier you used a word, and I want to bring it up again.
Yeah.
So I've heard a little bit about steroid injections.
Yes.
What would you like to say about that?
Yeah, so this is a kind of a trend in Douglas County, it seems, but people often come into the urgent care requesting a steroid injection for seasonal allergies, and it's a one-time shot. It just takes care of their allergies, and it works. So they come back. That's not a great treatment for most seasonal allergies, and in fact the potential risks of using that medication outweigh any benefit. So we know over time steroids mess with your metabolism, they can cause weight gain, they can weaken your bones, and they can cause some swelling and changes in blood pressure. So we really want to limit how much we're using that, and there's lots of other prescription medications we can also use to help with your symptoms without putting this unnecessary risk on you.
Well, thank you. That's really good information. So I know you've been with Evergreen for a little while, but in case people are just getting to know you a little bit, tell us a little bit about your backstory. How did you come to Evergreen?
Yeah, so I came to Roseburg 4 years ago. My job with the urgent care was actually my first job out of PA school. I moved from Colorado to this area, and initially what brought me this direction was the possibility of being closer to skiing. So I was looking at Bend, and then I love maps, and so I was looking at a map, and I was like, oh, this little town Roseburg is kind of interesting. And I came out to visit and went on a hike on the North Umpqua Trail, which I love. And that kind of sold me on it. And the group is phenomenal. So that goes without saying.
Right. And, you can still drive to Bend. You can still go skiing if you want to go that, 3-hour drive or whatever it is,
yeah,
right?
Absolutely. And we go over there frequently too, but one thing that we always value is when you're over here, there's really nobody around. You can be on the trail by yourself or on the water by yourself. It's a lot of undiscovered territory, so it's really beautiful.
Well, great. We're glad you're here. Thank you for your time and discussion around seasonal allergies.
Yeah, thank you.
And that's Allie Blaine, PA, from Evergreen Family Medicine. You can see her bio and more information about all the providers at Evergreen at evergreenfamilymedicine.com. And you can follow Evergreen on Twitter, Instagram, YouTube, and Facebook.